Good afternoon, everyone. We are low tech today, but I think in some ways it's a good thing because I've really wanted to take us back to some basics. I know I've been sharing a lot of numbers and graphs and data, and that's useful because there are some folks out there that I need to have that information. Mostly our hospitals and others who are doing a lot of the planning, but I know the media has a lot of curiosity to know some of the numbers, so we've always said we'll share with you what we know. But today I really want to go back to basics and tell you what all of it means. But first I'll start off with our numbers for today. We know that we have confirmed 1,406 cases, and the age range in that is less than a year, so an infant to the age of 96 with a median age of 52 years. We have 24% of our cases are hospitalized, 9% in the ICU, and I'm sorry to share today that we have 25 deaths in the state of Ohio. We also know that we have cases in now 66 of our counties. That's well over 75% of our counties. Again, all this data is the tip of the iceberg because we're still, and it's skewed by the fact that we're testing the sickest, those who are hospitalized in priority in our frontline healthcare workers. And we know there are some counties out there that don't have testing right now. So I want to share that with you. There's much more detail on our website, coronavirus.ohio.gov, which is also a place you can find everything that we share here. I know you get some different links at times, the New Together site, but we'll keep all that on one spot for you if you don't catch something. I do want to follow up with Quest and LabCorp. Thank you so much to our friends out there that are in the private sector lab companies. What the governor was saying is so important. We know you're getting slammed with a huge volume of tests from often many states, but it's so vital right now. Our data's lagging, as you know, 5 days at the least. And what you can also share that's important, not just the positive tests, but aggregate counts of people who are tested. So the total number of tests you've run and the negative test results. If you could give those to the Ohio Department of Health, along with those positive test results, again, on our website, coronavirus.ohio.gov, that will help us as a state do the most accurate planning. Very important to us, and we really appreciate you doing that. I know we're all in this together, and I know it's a hard lift. So I want to go back to my hurricane analogy. We said early on that this is an unprecedented situation, and very much like a hurricane, you start to know it's coming. So I want you to picture a hurricane out somewhere in the Caribbean in the early days when we first hear about it on the Weather Channel. And you know, they're telling us where it will land is at first they give you an estimate. It might be somewhere between Texas or maybe the Gulf Coast on Florida, and then maybe it's the East Coast of Florida. But they can't tell you exactly when it will hit or where it will hit. But as the days go on, you get a little bit closer, it gets more accurate, you start to see that trajectory of that hurricane. And so your predictions get better and better with time. Very early on in this hurricane, we talked a lot about Philadelphia and St. Louis, two cities during the great pandemic flu of 1918, 2 weeks difference in taking actions of social distancing and shutting it down, staying at home, made all the difference in the outcome. So very similarly, our models, which we have different modelers all over the country, they're giving us a compass. They know it's going on this trajectory, but the exact day it hits, the exact city and neighborhood is always a little off till it gets closer. So I'm saying large numbers to you, and I know they're scary. 8,000 cases a day, 10,000 cases a day. Those numbers, given 11.7 million people, are actually not that far apart. I know they sound drastically different. They're not that different. But the more important thing is this. Those numbers are helpful to our planners, but for the rest of us, what it is saying is that we are flattening the curve in Ohio. those numbers would have been 50 to 75% higher than they are right now. Our curve would have been much steeper had we not acted starting a couple of weeks ago. So every action you're taking at home is actually, in the case of a hurricane, changing how hard that storm will hit and changing where and when it will hit. So the actions you're taking at home are shrinking those numbers. So I want us to go back to our original chart. Ohioans, what we know is this. We know we are blunting this yellow and becoming the blue. We are stretching out the day of peak impact of the hurricane. And we're actually making that hurricane not a 4 or 5, we're making it a 3 or a 2. There's no scenario without a hurricane, as I've said. And now we know that this line of hospital capacity is moving down. We know that it's somewhere in the blue curve. That was our original calculation. But think about this line. Think about how many more masks, how much more PPE, how many more hospital beds, how much our general would have to build out if we were on this yellow curve. 75% more. We know that this is probably more down here now on the blue level. We know that there is no healthcare system in the world that would have had all the beds and all the ventilators in the world. We know we need more, but you at home have helped us buy time and really impact how much we will need. So our hospitals are using that data. They're using the best modeling available, and they differ a little bit, and that's not really important to us. What's important is that every day we lock it down. Every day we don't spread the 6 degrees of Kevin Bacon disease. That doubling makes all the difference for our frontline healthcare workers. It makes our PPE go farther. It makes us need less ventilators. So we need all that, and we're building it, but you need to know that what we do, and we keep doing it and doing it even better and better all the time, is really changing the strength of this hurricane. We know the wave's coming, but we know it's getting smaller every day in Ohio because of what you're doing. That's so important. So another message. I want us to think a lot in our neighborhoods now. We're sort of living in little villages, as we should. And we're using a lot of low-tech things. We already have Facebook groups with our neighbors and a lot of other technology at our hands. But I want you to think about the elderly in your neighborhood. And to elderly here, Ohio, like Italy, skews to an older population, and in some counties particularly so, in some neighborhoods particularly so. We know that the elderly are extremely vulnerable. We still can all go out if we need to, grocery shop once a week. But I'd much rather our elderly not have to go out at all. So I really need you to use your neighborhood social networks. There are other existing structures like Village to Village, nonprofit work that's going on in neighborhoods. You can look that up. But ways we can all chip in, help out with the yard work, help out dropping off food. We really need our most vulnerable to be able to stay at home. So I'm asking neighborhoods to do that. I know neighborhoods are doing things already, but we need more of it. The free lending library, the place where people's dogs stop and get bones and food, library books, helping with gardening, those sorts of things really go a long way. I'll share one last thing. For those of you who know me, I'd much rather be outside digging in the dirt about right now. And you know, it is beautiful out. Our bulbs are going. It's time to start dividing plants. Again, we have urban gardeners. When I worked for the Columbus Foundation, I did so much to empower our urban gardening movement. We need to get people outside doing the thing that is a great mental health. If you haven't done it before, I know it's always scary, but it's actually so much easier. But we can also be sharing some of those plants, doing some of that gardening, getting out of doors single-handedly. You can be alone. Being out there in nature is going to help you feel better. So let's get out there and help each other with that as well, at a distance, at a social distance. So enjoy the beautiful weather, keep socially distant, help those who are most vulnerable. Thank you.